So to my right is France Córdova. She is the director of the National Science Foundation, also the former president of Purdue University. Long list, which also includes the chief scientist at NASA. She is an astrophysicist by training. Emmanuel Fombu is the global and strategy digital innovation leader at Johnson & Johnson, which would be a really long title for us to try to put on the second line. He is all about AI, genomics, digital medicine, and the author of The Future of Healthcare, Humans and Machines, Partnering for Better Outcomes. So, when people talk about digital health and talk about moving health forward with partnerships right now, I sometimes think about that scene in Moneyball where Brad Pitt goes and talks to Chris Pratt about playing a different position, about playing first base. I think he had been an outfielder. And he says, well, how hard is it to play first base? Brad Pitt goes, oh, it's easy. And the coach goes, it's very, very hard. That's what it seems the idea of it often is very easy. The cross-pollination, harnessing machine learning to make things happen. But I feel like there's a lot of challenge in bringing it to reality. Where do you see right now, Emmanuel, what excites you about the possibility of it, and where do you see the biggest challenge right now?
What excites me is this concept of predictive medicine. I'm very happy to be here and have health systems like Northwell actually organizing such meetings, right, to discuss healthcare in general. But for me, I think one of the biggest challenges of what we can do is having the right partnership with all the key players in healthcare. So whether you're in the pharmaceutical side and you're in the hospital system, how do we test a lot of this kind of business models or healthcare models, right? So I did research, for example, where we could predict the risk of heart failure readmissions, but I don't own a hospital, right? So I'm from the pharma side, and I have all this technology that I could do. I could partner with Apple and do things, but then we also need to partner with the health systems and to test it with the clinicians to make sure this is the right business model, right? And so I'm very happy that Tom Thornton and Mercury Health Ventures have a consortium kind of plan that's kind of addressing this kind of problems that we have.
France, where do you see the collaborative approach? Certainly you've worked in lots of different science projects from the science end. When you start dealing with health systems, is it more complicated?
Well, I think that everything is complicated. So, and all partnerships are, like all relationships, are special, they're unique, and they have a real opportunity side and a real challenge side. And so I'd like to just show one slide.
Sure.
I only have one slide if I think Daniel's back there. So NSF, that's National Science Foundation that I'm the head of, has all those partnerships with industry, lots of them, as you could see, with other federal agencies. And these are just as of this 2018, as an example. International agencies, universities, and foundations, and nonprofits. And there's a real emphasis in this administration to increase our partnerships in all directions. And we find that it just leverages so much what we can do, because we're a research agency. Our budget is $8.1 billion a year, and hopefully growing. Our mark from the House is at 8.6, so we hope every year that it grows some. And 93% of what we get in goes right out the door. So our overhead is incredibly low, just a few percent. And by having these kinds of partnerships, we can much more expand what we are doing and into areas that are not exactly our historical mission. Our mission is basic research. So for example, if you take your smartphone, that it has so many technologies in it, and if you look at each of those technologies, every single one of them was first funded by some agency of the federal government to an individual, usually, or a very small team, and usually at a university or research laboratory. And then they went out into the commercial sector, and then Apple swept them all up and developed something wonderful. And that's how I really think of a partnership. It just allows you to to use what you're good at, and we're good at long-term investments in very, very fundamental research. But it's the kind of research that when taken up by a partner can end up in a hospital producing life-saving techniques, approaches, machines, and so forth.
You talked about Apple. You talked about how these things sort of wind up someplace where they might not have originally. Is technology right now, we see Silicon Valley, and you're familiar with Silicon Valley. They have one approach to healthcare. They have that Brad Pitt approach. This is easy, let's solve it. And then they come up and they meet up against the real life challenges of the things that you know in terms of dealing with regulations, and particularly healthcare regulations, and the effort to try to keep data private and yet at the same time liberate it. Are there any things that you are seeing right now that you think are working well or right now have the potential to work really well?
Well, from my point of view, the openness to partnerships is probably the best thing that's happening. The current administration wants to take down regulatory barriers. That's harder than just saying those words, because there's a whole lot of them, especially in the healthcare industries. There's other places, including in Silicon Valley and the IT industry, where there's not so much regulation and people are trying to keep it like that. So I just see a lot more drive to expanding partnerships in order to not only leverage one's resources, but really to go in whole new directions. So the whole theme of today is innovation. And I think you get more innovation and creativity when you expand the partners that you're working with and you're able to go into new directions.
Do you think the effort with FHIR and the effort to be able, for me to be able to have, and you and all of us to have our records, is that overrated or underrated?
To have our
records on our phone and be able to take them anywhere?
Well, I think it's wonderful. I mean, how many of us have spent just, almost years, if we add it all up, filling out the same form over and over again? And sometimes you go to the same office and you're filling out the same, and you say, why am I doing this? And somebody at the front desk says, because you have to, otherwise you can't see your physician. And yeah, absolutely. So one of my past experiences is I was a trustee of Mayo Clinic until I took my government job, and then you have to let go of all those sorts of things. And I think Mayo is very much, and I'm not aware of everybody else's efforts in this respect, but of trying to ensure that all your records are very digital. So when I go for my annual appointments at Mayo, and I could have something like 15 or 16 appointments with different doctors, they can immediately, when I go to the next office, they read the report, and they also read the past years and see how I'm doing, because you don't understand a patient unless you understand them over a long term.
And can you take those records from Mayo and go somewhere else if you were in California and you needed to go to Kaiser?
Yes, I could.
Would they have that access?
Yeah, I'm just not sure how every other company, if they can, read them and so on, but absolutely.
Emmanuel, in your bio, I read that you're all about AI, you're all about technology. Where do you see the promise of that now? And particularly, it's sometimes confusing to me when I hear about sort of digital health and pharma. Is that just an app, or is that just a Fantastic Four pill that goes inside of me so that you know what it's going to do?
I'll take a couple before I work with pharma, I'm a cardiologist by training, right? So I got into industry, but I've been in practice. I work at NIH, and I did research at NIH. I'm trained in heart failure. And I got into medicine, and I got into pharma specifically because they had funds available for research as opposed to being at NIH and applying for grants and winning years to figure out what's happening, right? And I think the biggest problem in healthcare is we are trying to create innovation by trying to fix Blockbuster instead of creating Netflix. Right? that's what we try to do. So the concept to me of what is possible is mind-boggling. So you mentioned Apple, for example, right? So I'm leading efforts. So at Johnson & Johnson, we have partnerships with Apple, right? Where we could build predictive models on atrial fibrillation on the watch, right? We're doing like stroke prevention kind of models on a watch. were able to recruit 400,000 patients in a clinical study within a 2-month period. Okay, and that's over like the budgets of almost nothing. Okay, because you go direct to the consumer to ask a question. Today, you could spend over $1 billion to do a study with 10,000 patients that takes you 8 years. Why is that acceptable in today's world, right? And so if you look at the idea also of pulling medical records into a phone, like you mentioned, I'm glad you're for it because I'm all about it, right? The basic concept of everyone today doing 23andMe, I just got my genes, my whole genome sequenced, actually. I just got the results yesterday. And my family's from Cameroon originally, so I was wondering where he would say I'll come from, maybe Ireland or something, I don't know. But I was looking at it, and it says I am 67% West African and 23% East African, and then a little piece of it from like around Congo area. I'm like, oh, interesting. So I looked at other things about me, and it said, well, I have a high risk of having hypertension. That was interesting. My grandmother had hypertension. I don't have hypertension right now, but that in my mind, I'm thinking I need to change my behavior, right? So I don't want to get to that point. That should be the basic concept of having that baseline foundation from genomics, and then having wearable devices like the wearable watches just helps enable how we live life. And health systems, I think, are in the best position to actually provide care, right? So if I'm in pharma, or I'm in a health system, or I'm a payer, we all have the exact same interest, right? If I could give a drug to the right patient and decrease readmissions for heart failure, for example, and the hospital has a decreased readmission rates, and the payer spends less money, and the patient gets to stay home, everyone benefits from this, right? And
you talk a lot about the business model. How do you make that happen? And how do you make that? Do you get the payer to pay for the Apple Watch to monitor? I mean, and there are health systems like Geisinger that have been doing it. Aetna has been doing it to a certain extent, paying for it. How do you get that cross collaboration in today's business environment?
I think one of the biggest challenges is we have this concept that the consumer will not pay for things, right? And so if you look at things like vitamins, if you walk into a vitamin store and you look at the sales of vitamins in general, they're off the roof.
Or now CBD,
billions of dollars in industry
everything.
in vitamins, right? If you come up with, look at yoga, for example, right? Everyone is buying yoga mats and do everything with yoga, right? Because people are educated about this, right? So I believe that if we educate the consumer will understand the need to prevent disease, and the consumer might be vested in this. We never give the consumer the chance. We make the assumption that they would not pay for anything help to live.
And we also, if you buy a yoga mat, you know exactly how much it costs, and you know that you can go 2 stores down and maybe buy one for $10 less. And it's not the same thing with a lot of healthcare. Right. The pricing structure and so many hidden costs and stuff, you just can't go up to the front desk and say, so I'm here, now how much by the time my hour's up, what am I going to be charged? They have no idea what you're going to be charged. And so I think that's very puts the consumer in a very uncomfortable place.
In today's world where we focus on reactive care, right? So I'm more on the idea of proactive healthcare, right? Rather than wait to get sick, can you be proactively involved in it? And so when you get sick, it becomes a different debate how much that costs, right? But healthcare should not be something that you only think about when you get sick, right? So if I wake up today, what should I eat for breakfast if I'm trying to lose weight? Maybe I should just have a tea and maybe have a burger for lunch and have something else for dinner based on my personal goals, right? That concept of personalized medicine, tailored to the individual.
But that is for those of us who are worried well. I see that all of us have a digital watch on, right? Esther Dyson, in fact, was the one who first introduced me to Fitbit, and I'm so glad there's something else because I kept washing it and losing it in the laundry. But that's for those of us who are already there, in a sense. How do there's so much emphasis now on trying to bring other people in through social determinants of health who don't have that aspect. And if you've traveled at all in this country, when I've been in the Midwest or in the South, I'll stop at a convenience store, and the only thing healthy to drink there is water. Everything else, when I'm there, they don't necessarily have the more healthy drinks that are in vogue and I can find in any store here in New York. How do you bring that to people who may not necessarily have the wherewithal to buy that watch or have just the means and access to the kind of information that a lot of us who are the worried well have? And how does collaboration, how can you work with that rural health provider or a school system or some more remote area to engage people?
I think by changing policy, right? So if you look at like St. Louis, for example, St. Louis has this street called Delmar Boulevard that splits St. Louis into northern and southern part, right? The northern part is mostly African Americans and much more poorer people. Southern part, people more educated, more white, and they make money. The rates of cardiovascular disease and cancer are 10 times higher in the northern part of the same line in the same city than the southern part of the city, right? If you go down to the northern part of the city or any inner city around the world, what you find out is you see the quality of food. You have this fried chicken every corner block, right? So that's the environment. So no watch will change your environment. What happens, right? And research shows this. So I think it should be a policy angle, just like we ban cigarettes and we prevent things, to actually prevent those kind of foods from being in. But instead, we sit there and we just watch this happen, right? So putting pressure on McDonald's to sell more healthy food, which is happening, right? And making healthier foods available should be very interesting, which to
and
me...
more affordable.
But it's very interesting
Right,
because...
that fried chicken is a little more sustainable, or the processed food is more
But why is
sustainable.
it expensive is a better question, right? So my family's from Cameroon. I grew up in France, but my family's from Cameroon. I spent time in Cameroon, where the poorest people in Cameroon eat healthy food, because that's all they can afford. In today's world, in Cameroon, the wealthy people eat canned food, because they think it's a mindset, right? But in the Western world, it's completely different, right? Or you have to have local farms, like in New York City, for example, they have neighborhood farms and things like that. You could grow your own tomatoes, right? You don't need to necessarily go to the grocery store to buy. It's that mindset and a cultural shift.
And there's another approach, too, other than smartwatches, and that's called teachers in schools, because most of our kids get to go to school. And I think, and I come from a whole family of school teachers, both my daughter's husband and so on, elementary school teachers. And they're, when they have the education and the training, then they can really help the kids along. When my daughter lived in Cincinnati, and every place that her husband had her moved to, she started a garden in the school and she always works with low-income English as a second language students. That's her background. So those are the ones she works with. And they always grow these farms out in the schoolyard. And she said the most interesting thing is that the neighborhood, which can often have other abuses going on, nobody touches the children's garden. And the children, they grow their vegetables, bring them home, talk about the nutrition and all the things that they learn in school. So there are many, many ways of approaching it, but you have to, as you're pointing out, you have to think about everything, the rural, the inner city, the suburbs, everything, and having a good approach to healthcare.
So as we are in the last couple of minutes here to close it out, I'd love for each of you to try to highlight one thing that you think is working really well, either one project or one area where you see collaboration really moving the ball forward.
For me, I think I've had opportunity, to be in discussions with companies like Conversa and Northwell, looking at heart failure prevention programs, where I see where pharma benefits, payer benefits, and you have a startup company that provides a perfect care management solution, and having.
And are the patients actually getting better?
Oh, correct. Yes, they are. Because if you look at things like readmission, right? If you drop down your salt levels, the rates of you actually being readmitted just drops automatically, just on basic things like just what you eat, right? And so having those partnerships of providers being involved with every other stakeholder to to bring about the triple aim, I think that's the right way to go.
Yeah, and maybe I'll just try two quick examples. So when I was at UC Riverside, University of California, Riverside, I was chancellor of that campus. I started a medical school. It was the first time a medical school had been started in over 40 years, and in this country. And the whole idea was to get more students with diverse backgrounds, underrepresented students, women, to become primary care doctors. And today, that is exactly what they're doing. When I visit there, I just see a really diverse collection of people. I think that the research shows that people want to work in the areas where they grew up in and give care to those. So I come back to education. It's just so important. At the National Science Foundation, we have a program called Includes, which is funding over 70 projects around the country where people propose different ways of involving communities, and especially young people within the communities, but getting industry, town councils, everybody involved in universities, and broadening the participation in STEM, science, technology, engineering, and mathematics, to get young children more involved in knowing about the benefits of science and engineering in furthering innovation. And I think that really in this country, broadening participation is what it's all about. We've grown a great country largely through immigration and through the idea of innovation. And now we have all sorts of barriers to that. We could have a whole separate conference on the opportunities and challenges of immigration. But one thing we haven't worked so hard on is broadening participation in our own country so that everybody out in every area has the access and the advantages in order to learn how to take care of themselves and how to become entrepreneurs and creators.
Well, on that note, let's leave it on that positive note. Thank you both very much.
Thank you. Thank you.